Last Monday, we had Danny Roth talking about globalization. All of these videos you can see on YouTube as well. There are many more speakers coming up. So as I said, next Monday is Jeremy Stein from Harvard talking about Fed Treasury credit programs. The next Friday will be Paul Krugman talking about recoveries and the speed of recovery, how to best manage that. Let me come back to Ramanand Laxminarayan's earlier presentation we had in this series, because he was talking a lot about how the modeling is done in India. He introduced this India SIM model, which his institute is building, the cddep.org. You can look it up. There's a lot of interesting stuff going on in this model. There are different levels of households, which is matched to the data, different regions, different states, rural and urban regions, a lot of heterogeneity built in. But these are all agent-based models that capture the behavior, very in a reduced form. While in economics, what's really important are expectations. If you want to understand multiple equilibria, self-fulfilling hypothesis, and all these aspects, expectations are very important. One of the leading textbooks out there on this type of models, so SIR models more generally, is this Anderson and May model. So that's building on this type of models. We will learn more today, in particular from an economics perspective. And I've never seen the economics profession, in particular the macroeconomics profession, so energized to really develop this type of models and build them into economic frameworks. Of course, there are also some nice simulations out there, and Ron probably will show us some of his simulation of his model. I very much like Ron Sanderson's 3 Blue 1 Brown YouTube channel, and he talks a lot about the simulations, very interesting simulations. The Rand Corporation has some very interesting simulations for all the various states in the United States. That's interesting as well. But one aspect which I think is very interesting to me, how to do the targeting, and I hope to learn more about that. You can do ex-ante targeting or ex-post targeting. So you want to keep the flexibility to do it ex-post targeting. And Germany has just introduced the so-called emergency brake. What's the emergency brake? It is some regional targeting where you say if a region has more than 50 new infected out of 100,000 inhabitants within a week, then the region will be locked down. So it can be a small county and you lock down this particular county. So Germany is opening up starting next week. And then they have this emergency brakes on, which is some targeting. It's more regional targeting, which is, a particular exposed way of targeting and locking down again. The question is enforceability. Of course, there's a lot of political forces at the local level which would resist the lockdown again. There's a lot of pressure to open up. But it also has an interesting implication. You want to make sure that your neighbor is not infecting anybody, is really doing some social distancing, because then the whole county will be locked down again. So some monitoring going on among the neighbors and so forth. So that's, I think, an interesting experiment. We have to see how it works out. And that's a particular form of targeting. Here it's more the exposed targeting. Then, in order to have these models, you have to attach a certain value of life to that. And I think Daron does this too in his model. And the question, how to infer the value of life? Typically, we do this with statistical value of life, but looking at wage differentials between hazardous jobs and less hazardous occupations. Of course, this implies some risk attitude as well, but that's typically how the economics profession tries to attach some value of life. We have heard earlier from Andrew Skeeton's webinar that he's very critical of this concept of having some statistical value of life. But then the question is also, when you do some discrimination across age, how do you take the expected life expectancy into account? That's another dimension where you say you attach probably higher value of someone young because there's many more years to live, and compared to an elderly person. Is this justified? Is this moral or not? There's huge ethical questions thrown up, which you can reduce the numbers, but behind it there are important ethical questions. But you might also argue in the particular models it might not matter, because what really matters is the externality and the externality of spreading the virus to others. And it doesn't really matter, whether what's your statistical value of life is. It's one person is equally likely to spread the virus. Then it depends more on other criteria. Who is, a multi-spreader, who is not, depending how socially active the particular person is. Then I would like to conclude my opening remarks by appealing to Daron to also put his model into some endogenous growth model in order to understand the different exit strategies and different ways of testing. So going back to Paul Romer's earlier webinar, where I said it makes huge difference how long this lockdown will last and how to get out of it very quickly. And it has huge implications for all of the growth dimension, the growth path we will have subsequently. And this could be a new chapter in Daron's famous book, Modern Economic Growth, to add, SIR models into it and combine the economics from the growth models with the epidemics models. I worked on some endogenous, some growth models with money and other aspects, which I will present on Tuesday in the VMAX webinar series. But of course, I don't have the SIR component in it, and we will learn more about the SIR component today from Daron. So we're looking forward to Daron's talk, focusing very much on targeted COVID policies, how to target, and how much you can improve social welfare if you have a much more targeted approach. Thanks again, Daron. The floor is yours.
Thank you, Marcus. This is a great opportunity. Thanks for organizing this series, which is fantastic. There's so many bad things that are coming out of this current pandemic. So the only minor, tiny silver lining is that we're learning to use webinars, which are so much more environment friendly than taking planes and bringing 50 people into a remote location, and hundreds of people can join. So I actually think this is something we should continue after these sorry days of the pandemic are over. So without further ado, let me start my webinar. So I'm going to try to talk about try to talk for about 35 minutes so that we have ample time at the end for questions, but I do, of course, welcome questions as well. So I'm going to draw on this paper, which Victor Chernozukov, Ivan Werning, and Mike Winston and I just released, a multi-risk SIR model, or MR-SIR model, with optimally targeted lockdowns. I'm going to try to put this into broader perspective and emphasize some of the weaknesses as well as the usefulness of this type of framework. But let me jump into it before it's too late, and then we can come to some of the caveats and the broader frame later. I think we are living through a unique period, not just because of all of the disruption and the loss of life from the pandemic, but there are, I think, very few episodes in history where essentially what you might call social science models are playing such a central role. SIR model, even though it has about viruses and immunology as well as other things, but it's really a social science model at heart because it's about social contact and social outcomes. And I think a lot of our thinking about the disease, its spread, how we can contain it, is being shaped by SIR models. And one of the key policy trade-offs that everybody is aware of, although they come down on different sides of this trade-off, is between economic and public health outcomes. And there is a lot of either formal or heuristic derivation of what optimal policy or good policy would be in this SIR context. Now, the problem is, as Marcus already pointed out, and people have pointed out in various different contexts, and some policymakers have already started exploiting, is that there's a huge amount of heterogeneity. Occupation, productivity, ICU capacity, labor supply are all heterogeneous across agents, and that has implications both for public health and for economic outcomes and the trade-offs. But even more important, perhaps from a public health point of view, and indirectly feeding into the economics, is that risk factors are highly heterogeneous. So some medical professionals characterize COVID-19 as two diseases, one potentially deadly, very dangerous, one for the older population, as well those with comorbidities, and rates, a few differences from South Korea. But as here, so you can see that the age group between 20 and 50 has 1/60th of the mortality conditional on infection of the 65 plus. So this suggests that whatever policy you do, even if you do uniform policy, it's going to have heterogeneous effects. And why is this important? Because now putting it into broad perspective, I think when historians write the account of this era in 30, 40 years' time, they will not be kind to policymakers and institutions. I think the world has largely failed both in international coordination, in providing the right public healthcare system, and developing the right nuanced policies. And I think, putting it in the context of some of my other work, this is partly because of the atrophy of some of the quality and capacity of institutions, lower emphasis on expertise and such things. And I think there's a separate set of issues to be studied there. But this heterogeneity dimension goes to the heart of it, because we really need to think about careful, well-targeted policies. So I'm going to abstract, uncharacteristically for me perhaps, from the political economy factors in the rest of the talk, and really try to think about what this heterogeneous structure of mortality rates imply for how we can deal with the COVID-19 pandemic. So more explicitly, what we do is we develop a multi-risk SIR model. The model is general, but specifically I'm going to apply it to the 3 risk groups that I have put in the previous table: young, middle-aged, and older groups. We're developing an optimal control problem. So I think heuristic optimal control is fine for policymakers, but I think we should understand some of the trade-offs, and they turn out to be very subtle. I'm going to try to illustrate that. We characterize and contrast optimal uniform and optimal targeted policies and clarify the trade-offs. So the summary of the main findings is here. What I'm going to argue is that there are big gains and significantly improved trade-offs from targeted policy. And in particular, most of the gains can be realized by very simple semi-targeted policies, which means we just treat the 65 plus group differentially in order to put them in, so to speak, protective custody, to protect themselves. And the rest is much similar to the sort of optimal policies that the literature has already considered in homogeneous setting. And a summary of that, and I think this is the best summary in my mind and in my co-author's mind, is not to take a specific ethical value about the value of life versus public health consequences, but present what the menu is. And the best way of doing that, of course, for an economist is the Pareto frontier or some sort of frontier. So here, that's what we're showing here. On the horizontal axis, there are deaths. On the vertical axis is the output loss, which is both output loss in the current period because of lockdowns, but also loss of future foregone productivities because people die or get sick. And the origin, of course, is the best place. We don't lose any output. We don't have any additional deaths. And the Pareto frontier, therefore, is a convex-shaped outcome. And the solid line shows what that Pareto frontier is, but if you do the best possible policy in the abstract, but uniform policy. And then the dashed line is when you do optimal targeted policy. The two meet in 2 points. If you do no control, there's no difference because you're doing any policy, so whether it's targeted or not doesn't matter. And if you do maximally feasible control, which means you lock down everybody because life is so valuable that you're willing to put up with as much economic loss as you want to save even 1 or 2 lives, then the two are exactly the same again because you treat everybody the same. But in between, there is a huge improvement, much closer to the origin when you do the targeted policies. And I'm going to put numbers on this. Of course, the numbers have to be taken with a pinch of salt. And so those are the important caveats. Victor, Mike, Ivan, and I are not epidemiologists. There are a lot of subtleties here. These are really sensitive topics. I think that's why it's better for us and for economists in general to clarify the trade-offs rather than pass our own ethical judgments. But I will, of course, put some numbers just to give you a clearer sense. And there's a huge amount of uncertainty about both the disease parameters for COVID-19 and relevant economic parameters. For example, what's going to happen to the supply chain, how much capital can make up for labor, how much people can work from home, joint labor supply issues. So I think there's a lot here, and that's why Marcus's point at the beginning is very much on target. One should think about ex post targeting, where as uncertainty about some of the parameters is revealed. We're not going to do that. We're going to work in a complete information setting here, but that's a very, very important next step. So we welcome comments, suggestions, and criticisms, and that's why I'm going to leave hopefully ample time at the end to talk about some of these. So here is the site of model that we're going to be working with. And this is a diagrammatic representation. If you take just the 4 boxes at the top and get rid of the subscript 1, that would be a typical SIR model augmented with deaths, because some of the people who are infected die rather than recover. And there might be some other choices such as ICU, non-ICU status for people who are infected. On top of this, we look at multiple groups. So here I put 2 groups, and each group has its own dynamics, but most importantly, there's a network aspect to it, because the 2 groups interact both at work and in consumption, and sometimes within households. So we're going to try to write the equations for this and do the quantitative analysis for this. Of course, this is not the right forum for going into the details of the mathematical structure, but I'm going to give you a few equations so that we ground the talk and the results. So in the classic, yes, please.
So Peter Dalton asked a question whether you assume that in order to die, you have to be in an intensive care unit before.
Yes, we do. That's an easy. That's a very good question. That's what we're going to assume. I'm going to come to all of those things in a second, but it's a very easy assumption to relax. Most of the deaths are in the ICU state, meaning that they are in need of ICU, but you may not, of course, be in an ICU if the capacity of hospital beds is not sufficient. So ICU doesn't mean that you are in an ICU unit. It means you're in need of intensive care. So in a classic SIR model, new infections are some parameter beta times S, which is the susceptible population, times I, which is the infected population. So we're going to generalize this in a number of ways. First, we're going to have multiple groups, as I've mentioned. So this the new infections in group J that's going to matter. Second, we're going to explicitly recognize that the beta in the classic SIR model consists of 2 components. One is conditional on a particular type of social contact. What's the likelihood that I get infected? So if Marcus and I shake hands and I am infected, what's the likelihood that Marcus gets infected? But hidden in there, there's a much more behavioral, social element, which is, do we interact? When we interact, do we shake hands? Are we in the same restaurant? Are we in the same job? And those are going to vary between different groups by age and by other characteristics. So those are going to be these raw JKs, and that's where the network element is going to come from. Another change that we do, which I'm not going to dwell too much on in this current presentation, but I want to flag it, is that if you look at the classic SIR equation, it's a quadratic equation. It's S times I. So that's for economists, the most famous quadratic model is Diamond's coconut model. But the literature in economics has also argued that in different settings, quadratic may or may not be the right one. I think in geographic, so if you're interacting with people in a geographic space, quadratic is an excellent approximation. If you're doing it in small groups, it may not be. So we allow for a more general matching structure to deal with that. And then, as usual, as in SIR models, population is divided into susceptible groups. This is the susceptible groups, infected groups, recovered groups, and the deaths, and that makes up the total population, which we normalize to 1. All right. Okay. All right. So more specifically, here are the infection dynamics, and I'm not K, LK components. What are those? Well, LJ